Hi, I'm Dr. Brian McGee, physical therapist with Rexercise. In the first two videos in my series on patello-femoral pain, I talked about some of the possible causes and treatment for this problem. We talked about how weakness of some of the hip muscles and thigh muscles, as well as tightness of some of these muscles, may affect the biomechanics of the kneecap as it moves relative to the end of the femur, possibly leading to pain. I demonstrated two home exercise programs that I frequently give my patients with this problem, one for flexibility, one for muscle strengthening. There are links to these videos in the description. In today's video, I want to progress the strengthening part of the program. In order to continue to make progress in muscle strength, the exercises have to gradually get more difficult, get harder. There needs to be some progressive overload. And by overload, I don't mean pain, I mean fatigue. I'm sure many of you have experienced this. You've done a resistance training workout at the gym. As you went to the gym day after day, week after week, you gradually added intensity to your program. You did more repetitions, you added a little weight, or you simply did more exercises. And this caused your muscles to get stronger over time. You engaged in progressive overload. This is how muscles get stronger. We'll apply this to our program in today's video. I'll demonstrate what I call my phase 2 muscle strengthening program for patello-femoral pain. For my patients, this is your home program. This is your reference, along with whatever individual changes we may have made. For those who are not my patients, as always, consult with your PT on what's best for you. Here's the program. Okay, so the first exercise for our phase 2 patello-femoral strengthening program is hip external rotation. So we're going to lay on the stomach. You might lay on your bed. If you have posts on the bed, you can secure this band to the post, or lay on the floor. You can secure it by shutting it at a door. You got the band around the ankle, band secured at about my ankle height, and I'm simply going to pull my heel inward. Hold for a moment, come back kind of slow to the starting point. Pull inward, hold for a moment, come back slow to the starting point. We're going to do this 15 times for 3 sets. Just back and forth. Again, inward kind of fast, back to the starting point, outward kind of slow. Okay, the next exercise, we're going to be doing a form of bridging, which mostly works what we call the posterior chain, hamstrings, glute max, but we're going to kick in our glute medius side hip muscles as well by using our band again. So we have a band around the knees. So if you're my patient, I've given you this to take home. So you're simply going to lay flat. You're going to lift up one foot. We'll do each side. So it doesn't matter which one you start with. Keep outside pressure on the band. Lift up the one hip, the stance side hip. Hold for a moment. Come down. Lift up. Hold for a moment. All the while, keeping outward pressure in this band. Up, hold for a moment. Pushing through the heel on the stance side. 10 to 15 times, 2 to 3 sets per side. Okay, so the next exercise we call a standing clamshell. So in this case, we're really working both legs. So you're going to balance on one leg, okay? A little bit of squat in that knee. Stay up kind of tall. And then with the opposite leg, move in and out. So both legs are kind of working, but the stance leg is by far doing most of the work. So we're going to do each side anyway, so it doesn't really matter all that much. So approximately 10, maybe 15 reps per side. So let's pretend that's 15, then we're going to switch. 15 would be a lot. It would be pretty tiring. So 2-3 rounds per side. Again, a little bit of bend in this knee, approximately a quarter of a squat, 45 degrees, maybe 30 degrees. Back and forth 10 to 15 times, 2 to 3 sets. Okay, so for our last exercise, we're going to use the stability ball. If you don't have a stability ball at home, a soccer ball, a volleyball works great, but you want to deflate it a little bit. If it's super inflated, it's really hard to do because the ball just wants to scoot all over the place. So I put the stability ball at the side of the knee. I'm keeping outward pressure into the ball with this knee. And in this case, this is really the working leg. The stance leg is the working leg. I'm going to lift up, in this case, my right side. So I'm working my left side. I'm going to do little squats while I'm maintaining lateral pressure into the ball. So again, we're kind of working both sides, but mainly the stance side is doing the work. So in this case, we'll do both legs. Again, a set of 10 to 15 per leg, 2 to 3 sets. Just little squats, approximately a quarter depth. Up and down, it gets pretty tiring. Okay, so that's our phase 2 patello-femoral strengthening program. I hope you found this video helpful. I hope it helps you get back to what you love to do. Please like or subscribe, and we'll see you next time.